point, I think it was really important for us to know about people's lives. And so, if I knew someone had called them sick or seen something on some type of social media, I'd be like, hey, how is your daughter doing? Like, I saw that they won that gymnastics thing. And
Hmm.
people really responded to that
Of
because they
course.
were like, you care more than just about how I'm going to show up and do this job today for you.
Welcome to Safe Space Made Simple, a practical podcast that guides clinical leaders and healthcare managers to create trust and support with their teams. I'm your host, Trace Hobson. Join me for weekly interviews, practical tools, and inspiring transformational stories of bringing people together in healthcare. Now, let's dive in. Hi, everyone. Welcome to Safe Space Made Simple, the podcast that's devoted to helping you as a clinical leader, manager, and team to develop a safe space. I'm very excited about today's show today. We have Simmie Kala on, who is a healthcare leader and specialist in nurse education, especially as it relates to critical care. In today's show, we have a conversation where Simmie shares very practically applied advice for clinical leaders, managers, and teams to create a space where people feel safe and they can develop the relational equity that they need to navigate complex, complicated healthcare environments. So I want to get right into this conversation because it was just so energizing for me to talk to Simmie, and I know it'll be for you as well. So without further ado, let's get right into the show. So, Simmie, thank you so much for being on the podcast. I'm really excited to have you here. Could you share with us a little bit about your work, who you are, and what you do in the world?
For sure. Thanks, Trace. So, like you said, my name is Simmie. I've been a critical care nurse probably for about 18 years, a nurse for 23. Definitely have always loved that part of my work. I've been really probably dived into education, I want to say about maybe 15 years ago, and then completed my master's. And I really love professional practice and like best practice standards and all that. But my heart and I think, love within healthcare really lives within that education space. And
Mhm.
how do we, especially within the health organization space versus the post-secondary, and really how do we support education for staff to really impact retention, recruitment, internal motivation, and what do we need to do to keep our staff happy and healthy within their spaces? That's probably what really drives my work. I've had various roles as an educator, clinical educator. I've worked with PSIs, and more recently, I kind of lead a team to help develop a culture of learning within an organization. So
Mhm.
that's probably a little bit about me. Yeah.
So I love that you're here because one of the intentions of this podcast has been from the beginning to have folks that are working on the ground with teams in the real world. And I also love the fact that you are a clinical nurse educator and specializing in critical care because I don't know why, but ever since I've gotten into Canadian healthcare, I've had all these really wonderful clinical nurse educators and practitioners who work in critical care sort of take me under their wing and slowly show me how it is in their world. And it's been just a wonderful process to learn and also a little bit, at times, a little dysregulating too, to see what it is that people that work in critical care are going through, especially from a nursing perspective. And so I'm curious from your perspective, your vantage point, how do you create a safe space in an environment like that where it can be, a human being's worst day and you've got family members that are there and all of that. From your perspective, what do we need to do to create a safe space in those environments?
That's such a good question. It's something I've given a lot of thought to because we see staff who love critical care and they're happy in it and they're just that naturally resilient person. And then you see the staff who aren't. And it's like, well, what makes someone resilient and what doesn't? And, and I really think that it's the environment that people are in and the coping strategies that people develop or are encouraged to develop. Maybe I'll put it that way. And so I have always really thought, oh, I'm so privileged even to be at the end of life with somebody and their family. I feel privileged to be a part of that death. And I've had staff say, I hate it. I don't want to do this. And then when we dive into the conversation, it's always been around the support that they had around them during that experience. And I think the main way that we set up spaces, critical care, acute medicine, emergency, like, to be honest, I think all healthcare spaces right now, like, they're all struggling, because we're all kind of functioning like critical care spaces because of the shortages and just the amount of critically ill patients all over in various reasons. But I think the main thing that I find is that as a leader, that relationship that you build with your staff is one of the most important things that you have to do. And so when I was the educator, I learned really quickly that if I could make contact with my staff, struggle with them, not always having the answer, was the easiest way for me to show them that they weren't alone in something, and for them to then be able to really step up to their full potential. I used to always say to folks, like, I don't know the answer to this, but I'll sit here and I'll struggle through it with you, because that was all I could do in that moment. And that took some time because I wanted to have the answer and I wanted to be helpful constantly, but it just wasn't the reality in a space where things are constantly happening, things are constantly changing, and you're constantly short-staffed in many spaces. But that's what I would say is the most crucial thing, is that you need to show up and you need to be able to prioritize humans over the work tasks when that happens. So if there's a critical incident on the unit, okay, I'm going to stop my meeting, I'm going to leave, and I'm going to go to the floor. There's a code, I hear a code in the unit, I'm going to leave what I'm doing, and I'm going to go to that bedside, even if I'm just standing there to help debrief post, right? So I think that's what worked for me, was I really had to realize that I'm only as good as the people that I work with.
Yeah, I love what you're sharing right now. And I also hear some other voices in my mind. First of all, the relational equity piece that you've got to build as a leader, I'm totally in agreement. And everything in our podcast that we're doing really highlights that over and over again. And yet, I have to be the devil's advocate as well and look at this and go, okay, so if you're leaving all the things that you need to do as a leader or a manager to develop relational equity with your people, how are you as a leader dealing with that and coping with that? Because I guess my concern is for you that you're going to be working till 11 o'clock at night trying to get everything done.
Yeah, for sure. And you know what? I'm not going to lie. Sometimes at the very beginning, when I was first learning this, I definitely did. There were some days where I was like, okay, well, I haven't looked at my emails all day. And I did that. And slowly I started to realize that I could put some structure around making sure I had opportunity to build relationships. So one of the things that we did was I met with our leadership team in the unit and I said, hey, folks, I want to make sure that from like 7:30 to 9 o'clock, none of us are in meetings, because that way the charge nurses can focus on figuring out what's going on with the unit flow. And as the educator, what I can do is check-in rounds and having those guided by really clear questions, guided questions to guided discussion versus, hey, how are you doing? Because I found people will just say, I'm fine. And they're definitely clearly not fine. And so I was like, I wanted to implement that. I was like, I want to have guided discussion questions that we walk around, whoever can, but at least that way I'm not missing a crucial meeting with my team between those hours. And it wasn't difficult because people were like, okay, yeah, that makes sense. Let's not have a meeting no meetings in the calendar until 9 o'clock. And even for our manager, that was hard, but it was like, okay, we're just going to decline. We're just going to, until it became normal that, oh, they're never going to say yes to a meeting at 8 a.m. Right. But it was something that we had to connect to as a team, and then the staff knew that we were around. And it got to a point where, when we first started walking around, people were like, what are you doing here? Because, they're suspicious. You're checking on me. And then we released, it just became natural. And I knew we had connected when I remember one morning I was just running late because of a personal appointment. And the staff come up to me, they're like, where were you? I was waiting for you at 8:15 to talk to you about this. And I was like, well, I'm so sorry. I should have let you know I was off. But it was like, it changed from them being suspicious of us showing up and having good, purposeful connection to them being like expecting it and wanting it. But we did have to do that. And to be honest, a couple of times I really realized that we have to lead by role modeling,
Mhm.
and an email isn't always important. And that was something I had to really ingrain in myself. And I was like, people, if it's really urgent and important, people will call, people will text. And I needed to start communicating that I may not respond right away to an email, but I will respond immediately to a phone call or a text.
Mhm.
But an email is going to take a couple of days. And then I'll be honest, I wanted to set that precedence up as well,
Right.
because I wanted people to get comfortable with the fact that they're not going to get an immediate response. And also on my end, getting comfortable with the fact of not having to give an immediate response, and rather that piece. And so I think there was a little bit of role modeling that needed to happen, but also let's put structure in for time to connect with staff. And that
Yeah,
way it's kind of protected.
I really appreciate how you're making that very practical, because in my mind, when we want to operationalize something that might be a bit out of the norm, we do need to make it super simple and practical. And
Yeah.
I've learned the same thing that you're talking about as well. We need a structure to the time we spend, but also we even need a structure for the meetings. And I call them healthy huddles, meaningful
Yeah.
meetings, and I care conversations that have a template and even scripting at first, so that people can get comfortable with doing this. And I've noticed that when we have that kind of support, that it definitely builds the relational equity that needs to happen in a complex environment like this.
Yeah.
What have you found now that you've done that kind of a practice with building the relationship with your team? What have you found with the task list that maybe at the front end of that was like difficult to get to and pretty onerous? Has anything changed with that?
Um, I think what's changed is probably my and the team's understanding of priority setting for tasks.
Mm.
And so before, everything seemed urgent and everything seemed like we needed to answer all the pieces right away. One of my colleagues, we used to, laugh because she always had like a piece of paper with a little like box next to like a bunch of tasks, and she'd have like 20 per day.
Right.
And what we realized that was we all kind of had something like that. And that we also started doing purposeful like leadership huddles. And so, once every 2 weeks, we're like, let's us get together, check that this structure is working for not meetings before 9, but then also what are the tasks that we're losing, because maybe we need to be adjusting who should be doing what, because sometimes things are just landing and they're not right on the right person. And so that led to a little bit of like task reorganization, and reprioritization. And to be honest, what we learned was that we were prioritizing a lot of tasks that felt good to be completed, but weren't a priority. And
Right.
so there was a lot of like, I think, reflection after the fact. And the biggest piece was, because for sure everybody was like, Simmie, we don't have time for this. This is crazy. The staff don't want to talk to us. We don't have time to do it. But what we found was that we were starting to uncover issues that were happening clinically that we would never have learned otherwise. And they were actually much more significant than some of the tasks that we had on our
Mhm.
task list,
Right.
because those were all things, barriers, and issues to good patient care that we had come up with, but it hadn't necessarily shown up from the staff. So something as simple as, I remember from the dialysis machine, staff were like, when we have a patient in isolation, we don't know how to empty this. So we're actually just putting them in buckets and carrying it away later. And I was like, oh, that's heavy. Like, how are you guys doing that? And they're like, well, we don't know how else to do it. And I was like, well, why don't we get the sinks fixed over there within the rooms and then just have them like isolated for that?
Mhm.
So that was a task that we then prioritized, but only because we learned that there was this workaround that the staff were doing that was actually inhibiting their time and delaying some of the care that they could be giving. Huge win for us, easy win, but it wasn't a task that was even on any of our task lists. And so that when we started seeing the benefit of actually being able to prioritize things that we needed to do as a team that directly impacted the patient and the staff giving care to the patient, those wins were so big that it was easy to look at the tasks and be like, well, this is not going to give me that. So let me prioritize that a little bit lower. of course, things like budget and that kind of stuff for a manager always came up, but it was like, well, let's make sure that the right people are doing the right tasks, right? Like we don't need 4 people working on one change. And maybe the manager needs a couple of hours in the afternoon to focus on the budget. And that was totally okay because we were able to really relook at who is doing what.
Mm. How long did it take you
if that
to?
answers your question.
Yeah, it's great. Like, how long did it take you to set that kind of a system up as you got into the role? And once you had it set up, what kinds of things did you notice about the general morale of the team and some of the things that were going on for the team themselves?
It took a while. And I was really lucky that I became an educator in a unit that I had worked in for 10 plus years.
Right.
And so I had really strong relationships. And I was in a position where I could say to someone, can we just try this? Because you know me and you know that there's a good intent behind this. Because there was a lot of resistance, especially some people like 8 a.m. meetings because it cleans them up for later, for instance, even the meeting piece. But I think because we were able to really point out the benefit that the research shows about connection with staff, and that, I think my main concern was that we knew we had a lot of really junior staff. And we knew that because we were such a large unit, that staff didn't necessarily have that connection to each other. So that natural kind of mentorship that can occur on a unit wasn't there because of the experience that was available.
Right.
And so I was like, the only ones that can have that is the folks on this team, on the leadership team. So I think because we were able to describe the need for it because of the impact, not only to the staff, but the patients as well, was huge.
Right.
And so people bought into it, and we committed to, I was like, let's try it for a month. That's it. Let's try for a month. And then let's reevaluate. And after a month, we said, okay, let's try for another 2 months and let's reevaluate. And then we started talking about what were the changes that we're starting to notice as a leadership team about our staff and about the work that we're doing. And what we started finding, again, other educators who might not have been on board with this as I was, because it was my idea, was like, I'm starting to actually do work now that's going to really, truly impact patient care,
right,
versus tasks that we were just having to do. And, even things like, sometimes like policies are not something that an educator is like, yay about, but we were like, we actually need this because staff are struggling on how to work through this clinical decision making. And so things that we also thought were kind of mundane and we didn't like doing, we actually increased because we saw the impact on the staff. And then I think the piece that really moved is because we were trying to I was like, let's just be consistent, reevaluate constantly with our time, was that the staff impact was so clear. Like I said, like staff were like, oh, what time are you coming by today? They were waiting for us if there was new equipment. We started talking to patients and families because, when you're walking around, you'd be like, hey, I'm Simmie, blah, blah, blah. And like, families started to report, oh yeah, I met your educator yesterday. Maybe she could talk to us again today about blah, blah, blah. So staff were starting to notice that we weren't now kind of hidden behind a wall, but more accessible, not only to them, but to patients and families as well. When we're doing our check-ins, you need help with a turn, let's do a turn together. You needed help getting some equipment, let me go grab that for you. So there were so many other things that started to happen during our check-ins that the discussions really led to learning a lot more. And I think as an educator, the really neat thing that all the educators bought into right away was that it helped us actually organize our day. So if we're going through and the staff member says, hey, I'm going to MRI for the first time with a ventilated patient, I was like, hey, do you want me to come with you? Like, do you want support? Like, if it's not me, I'll make sure somebody else senior can come with you. And they would be like, yes. So we know the time. Okay, 1 o'clock, I'm going to do this. 2 o'clock, I've got to do this special dressing with somebody. So then between the educators, we started to notice that we could actually plan our day a little bit better. Whereas before, we always felt like we were just putting out fires because we didn't know what was happening. And so it was like, okay, I'm going to do this at 1. Okay, you're going to do that at 2. Okay, I'm going to do that at 3. Okay, well, from 1 to 2, I'm going to sit and just check my emails. Right? So it actually helped us organize ourselves better.
As you're describing this, I get a really clear picture of the difference between sort of being, I mean, you use words like behind the wall, or
Yeah.
the sense of sort of isolation between leadership and education and staff. And then the way you're describing it is like, now we're in it together. We're walking
Yes.
down the halls together. That's
Yeah.
such a clear thing that I hear in what you're sharing. And it makes me curious too. Your original concern was around mentorship between staff. What did you notice in that area, if anything, after doing this for several months and a
It
year, et
was,
cetera?
well, I think what we noticed was that because we were getting to know our staff better, we were able to identify some really strong people. So, someone doesn't have to be great at everything. They could be great at one thing, and now this person needs help with that one thing. So,
Mhm.
what we started doing was I was like, well, rather than again thinking about, succession and getting the team to work as a team, it was like, well, why don't I cover your patient? And you're so good at this skill, maybe you can go and help Trace at Bed 10. Right.
Right.
And so you almost started to make other connections. And again, that was hard for us as leaders because we're used to just like being, quick on time and let me just help because it's easier. But what we were like was like, well, let's build capacity another way by relieving really strong staff to go and help and mentor somebody else.
Mhm.
And so those kind of things started to happen. And then staff automatically started doing that. Hey, Simmie, can you come cover my patient? I want to go do this burn care dressing with this person that's new at it. Yeah, no problem, right? I mean, I
Mhm.
can easily sit there and watch a patient and check my emails from there. While this other staff member is now going and doing the skill or the clinical reasoning stuff with that new nurse, and they're now developing their own relationship. The other relationship that we started seeing was actually our relationship amongst the leadership team. Because before, again, it was like, okay, educators deal with this, charge nurses deal with this, manager deals with this. And what we realized was like, well, actually, maybe they don't need me. They just need the chargers would be great at this. This skill with the staff. And so mentorship started to become really more about not the group that was helping, but more about the people that were helping, and that there's capacity in all of us to do really cool things amongst each
Mhm.
other. And
Yeah.
I think the other piece that we started to notice was like staff would come up to us and knock on our door and be like, hey, Simmie, person X, they're going to be going for, they're taking their patient to the OR for the first time. I think they could use a little bit of help. And I'm really busy at that time. And I loved that because now people were advocating for each other. And
Mhm.
and they'd be like, hey, I'm gonna go let the educators know that you need a little bit of help with this. Does that work for you? So there was just like this kind of natural progression into who's available, who's the right person
Mhm.
versus it has to be the educator group.
Yeah, that's a
Um,
manager job. That's an educator
that's
job.
exactly,
That I
exactly.
love what you're sharing because the relational equity in my mind, the way you're describing it, is what helps to do a couple of things to navigate complexity
Yeah.
in really complex, complicated environments like we're talking about in a healthcare environment. But it also closes those gaps that are there between the frontline point of care clinical leaders. That there's a big gap there, and then there's another gap between the clinical leaders and the manager. There's a big gap
Yes.
there. Then there's another gap between the manager and the executive leadership or the director. So
Totally.
what you're describing sort of flattens that and makes us all human beings doing a job together. Let's work through this together. So I really
Perfect. Yeah.
appreciate what you're sharing. And then the other part I'm wondering about, because we talk about psychological safety and psychological health and safety a lot on this podcast. And what do we need to do to create that kind of an environment in a team or group, but even in an individual? And I think about the manager who is struggling to do what you're talking about because of their own sort of view and mindset with what their job is. And so I'm
Yeah.
curious, what would you say to maybe that earlier version of yourself that was maybe trapped in the tasks and
Totally.
not really developing those relationships?
Yeah. Oh, what would I say? I think I would I would encourage them to take a big breath because there is
That's
so
right.
many pressures. And, I feel so much for managers because I find many times they jump in and they don't even have handover or orientation. And it's, I think of that in a lot of healthcare roles. We're just really great clinicians. And now we're going to go be great leaders and educators. And it's like, oh, that actually takes a skill. And so I think what I would say, and I wish someone had said to me, is that you're going to develop this skill slowly and that you take the time to learn how to lead because it's a common misunderstanding within healthcare that just because you are a strong nurse or a strong physio, you can be a strong manager and it's just going to be an easy transition for you. And it's not an easy transition. Leading people, motivating people to do work during crisis is a really, really difficult thing. And making time for yourself to learn those skills, those core skills. I don't like the term soft skills at all, but those core skills where you can lead a team, you need to make time for that, even when it feels like the world is falling around you.
Yeah.
And so, and again, one of the best pieces of advice I ever got was no email is urgent. People will
Right.
find you if it's urgent because I felt good when I had a minimum in emails in my inbox. I was like, yes, I have succeeded today. And learning that that's not success, right? Like my inbox
Mm,
could be 1,000 emails and
right.
that could still be success. So what kind of, again, what would I say to myself is make time to learn the skills that you don't have
Mhm.
and give yourself some grace while you're learning
Right. Right.
and also be very transparent with your team, right? I think that's something that has always helped me is in all of the different roles I've held is that I don't know. I'm going to see if I can figure it out or find the right person to do so. I think that makes you human. That makes it okay for your staff to be human and not have answers. But I think those are some core pieces I would tell any new manager because you're just
Yeah.
inundated by the things that need to be done versus
Yeah,
the people.
it's an easy place to sort of hide as well. Not that managers are hiding, but I'll just speak for myself. I know at one
Yeah,
time being sort of in the tasks and getting things done was a great way for me to affirm myself and to sort of find my identity in that. The problem with that,
sure.
of course, was when I was doing great, then I was doing great. When I was not doing great, then I was a bit dysregulated at times. And so
Oh yeah,
oftentimes I would find myself behind that wall, that metaphorical wall you were talking about, where I
yeah,
was answering emails, doing sort of work in my office. And then I would say like, well, why, I'd find out about a problem and I'd be the last to know. And I'd be like, well,
yeah,
why you guys, I told you I have an open door policy. Why didn't you come and open my door? And I've realized since that an open door policy is the worst way to build relationship because what they really needed from me, I discovered later through what you're describing too. I had to get out of my office and
yeah,
go and be with those folks shoulder to shoulder in their
yeah.
world, developing a real relationship with them. And there was no way to delegate that. I had to
No,
do it I had to be the person, right? So I really
yeah.
appreciate what you're sharing.
Yeah, I think I love what you just said about the open door policy. I was trapped in that a long time ago too. I was like, yeah, open door policy. Everybody come on in. And then you're like, and I felt so great when I got my emails cleaned up. I felt like I responded. All my flags were gone, for things to follow up on. I loved it. But I would almost get frustrated, right? When I'd find out about an issue or people were talking about something. And I was like, why didn't anybody tell us? And it was
Mhm.
really that, well, then they have to leave what they're doing and they're doing patient care, right?
Mhm.
And so them leaving is actually a bigger safety issue than me leaving my office.
Right.
And it was a very senior staff that said that to me because I was like, why are people telling us things? Because she would come and tell me, and she was like, how are we supposed to leave? When are we supposed to leave to come and tell you guys things in your offices?
Not only
And
that, but
I
it's
was
also
like,
really scary to
ooh,
approach that closed door where you know your
yeah,
boss is and knock on the door and say, "Oh yeah, by the way, here's something that's
yeah,
now." I mean, that's the last thing I want to
totally.
do, right?
Yeah.
It's-
When it feels like being brought into the principal's office, and this is where again I think
exactly.
safety and in the environment, right? And it reminds us of when someone's like, oh hey, can I had to stop saying this to people because every time you get that weird reaction of like when you're like, oh hey, can we chat for a second? Immediately people think they've done something wrong, right? And
Right?
so I was like, oh, I feel I respond to that the same way. And I was like, oh, I need
Yeah.
to change how I say that. But
Right. It was
the
like that reminds me of when I was a kid and I used to get the announcement over the PA when I was in elementary school. Trace Hobson, please come to the office. I knew I'm in
absolutely,
trouble. I usually was
you're
doing
like,
something wrong. I probably
oh
did get into trouble, but
yeah.
nonetheless, like as an adult, yeah, that's exactly how I felt as well.
Oh, 100%. And to this day, even knowing what I know now, like I still react that way if someone says it to me, whether it's
Right.
my family or it's someone at work, you have that same like, oops, what did I do wrong? Right. But, and this is again, whereas like, the office doesn't feel safe for a lot of people unless we
Hmm.
make the change where that is a safe space. But like right off the bat, that's not a safe space. People go into
What about
offices to talk
what
about
about
bad things.
now, Simi? Like what about now? Do you find that people are approaching you more now that the people are knocking on your door?
100%. I mean, now I'll have staff text me and say, "Hey, can you pop by bed 11 when you get a second?" So
Right.
like now the open door policy is really open door, right? They know they
Right.
can text me, they can email me, they can knock on the door, they can stop me in the hallway. And so I think that's what matters. And that's what we learn the big projects that we need to work on is actually from the folks who are doing the work and the problems that they're finding.
Mm.
And so we're not functioning on assumptions now, we're functioning on reality. And it also lets us be a little proactive with the things that we need to change and improve.
Wow.
And the staff see that. And so I think that's been huge. And again, not just myself, but anybody on the leadership team, right? Like that transition was made. And I think that motivated people as well to really show up. Um, and have some fun with each other too. Like, sometimes like it wasn't a big discussion. Sometimes it was, I made a point. I think it was really important for us to know about people's lives. And so, if I knew someone had called in sick or seen something on some type of social media, I'd be like, hey, how is your daughter doing? Like I saw that they won that gymnastics thing. And
Hmm.
people really responded to that
Of
because they
course.
were like, you care more than just about how I'm going to show up and do this job today for you. Because,
Yeah.
God, I remember growing up in you leave your personal life at the door and you come to work and and that's just not our world anymore. Not with
No.
what's happening with the
No.
social awareness and stuff.
Well, especially as younger folks hit the workforce as well, I noticed
Yeah.
that those that are a bit younger than me, or even a lot younger than me, and coming into healthcare, they have a different value set where relationship is really important, and it really
Yeah.
it's one of those things. I've even heard and talked to nurses that have followed their manager around to different places where they were posted because they had that kind of relational equity. So I
Oh,
really
yeah.
appreciate what you're saying. So just looking at the time, I want to be respectful of your
Yeah.
time, Simi, and I'm just wondering, I would love it if people could reach out to you on LinkedIn. Is that the best place for them to reach out to you? And what are you working on right now that you're really passionate about?
Oh, okay. Yeah, definitely. People can reach out to me at LinkedIn, just Simmie Kala. And I think what I'm really passionate about right now is we're really developing a little bit of a team here, and working on what do new graduate nurses need, and not
Mhm.
just nurses but also allied health staff, because I feel often they're left out a little bit. But what do people need when they transition from being a student within your school world and now being an independent professional, and really even understanding, what does it mean to be part of a union, what does it mean to be part of a profession, what does it mean to make decisions completely on my own? So really looking at, there's so much that we learn within our post-secondary institutions that is absolutely foundational and important. But now we need to learn about that journey of becoming a professional. So really, I think that's something that really is so interesting to me. I think the other piece that I'm really, really excited about is educator development. So of course, as you've probably heard, I just think educators are phenomenal within the clinical setting. And I think they
I
have
do too.
such
They're
a
awesome. I learned so much from educators.
right.
It's incredible.
And they have the biggest impact on staff morale, I think. I really do. Because I think a strong educator can make or break a unit. And really looking at what do they need. And we talked about this a little bit earlier, right? But in healthcare, we've had this like a good clinician will make a good educator, will make a good manager. But we know that's not true. When you look at I think we have so much to learn from the post-secondary world where they really dive into supporting their faculty. And so we need to start thinking of our educators as our healthcare faculty. And what do they need to be able to do their jobs really well, to understand relationship equity, to understand why should they try to prioritize this over a task. So in order for safe spaces to start to build, I think we really need to dive into our educator group and be like, what do you need so that you can make safe spaces for your staff? Because I think they're the most connected to them. And for us in healthcare, our education can't just be 9 to 5, Monday to Friday, because our healthcare systems function 24 hours a day. So to really get innovative in how are we supporting those who do the work, and how are we building environments and resources that motivate them internally to be present and to show up on really hard days. So
Yeah, that's
that's a little bit of
amazing.
the work we're looking at.
Yeah, I love your passion for this work and also what you're doing in the world. And so that, just be clear, everybody, if you felt that this resonated with you, reach out to Simmie on LinkedIn and let her know. And Simmie, thank you so much for your time. I really appreciate you and the work that you're doing.
Thanks, Tracy. To you.
All right. Thank you so much for listening to the entire show. In the show notes, you'll find a way to click and link in with Simmie and reach out to her and share the impact of the show. It's always nice when you hear about the impact that you have. And so if this resonated for you, please reach out to Simmie and let her know. There's also a link there as well for a quiz that I've created for healthcare leaders to tap into their superpower. What is your healthcare superpower? Well, if you click on that link, there's a fun little quiz for you to take to find out which superpower archetype are you. Are you a cat, a bunny, a fox, or a deer? Click to find out. All right. Thank you again, everybody, for listening. And remember, as you go from here into whatever you're going to do next, to be a safe space. Have a great day. Thank you again for getting to the end of this podcast. And if you enjoyed this and you found that there was value in it for you, my invitation is for you to subscribe for future episodes that come out weekly on Tuesdays. Thank you again, and I'm looking forward to being with you next time. Now remember to be a safe space.